Okay, good evening. I'm gonna try to make this not too long. I will be talking about the concept notes for this module. It does involve a lot of like U.S. healthcare system and mental health and behavioral health. So I feel like this has been a topic that, on top of chronic illnesses and like healthcare system in general, I have strong interest to, especially because as a CNA, I've worked frontline with a bunch of Baker Acts patients, and I've seen how they live a very unpredictable and unfortunate life, and the system just kind of failed them. And I can say that not only because, you know, but I've seen it multiple times, and reading about it and learning more about it, it's a little bit worrying, but it is what it is. So I will kind of implement some um, experience that I had along the way. But like I said before, working as a CNA and being the person that they call to float to the ER or to float to any floor to stay 12 hours in a room with a patient with mental illnesses for any reason, any background different. Like, I've been with adults and with children. And it's something that it's unfortunate that my perspective on mental health, it was that this was all new, and like nobody was like talking about mental health illnesses or any of that until now. But all of the information tells me like otherwise. It's not like, barely on the 1800s and the 1900s, um things got a little bit more like in the conversation. But it's, if we think about it, it's been over 30 years that mental health and mental illnesses are part of a conversation, yet are not being prioritized or are not being taken seriously like they're supposed to. So I did mention in the knowledge assessment about how the comparison with the two presidents specifically, and the reason why I keep bringing this back is because it's so interesting how we need to wait until someone with power is actually affected so that they can be very interest and understand the importance and the and it's just like the importance and the urgency of taking care of this population. And in the 1960s, when John F. Kennedy was the president, and he was the one who kind of pushed and brought this to the table and brought this as like something very important for him, because he had a sister that was going through mental health illnesses and knew the struggle firsthand. So that's why this person or this president, it's so like focused and so determined to bring something positive for this community. And a couple of years later, unfortunately, like after the tragedy and like other parties taking over the president of the US, like President Nixon, Richard Nixon, it's like, oh no, US is, carrying too much for people with mental illnesses. And he believes that it's just like there's too much involvement of the federal government for this population, and he does not agree, or he's like completely opposite of like what John F. Kennedy stand out for. And even in the knowledge assessment, and I want to mention it here too, it's kind of the same thing that we are seeing nowadays with like what the ACA, the Affordable Care Act, implemented by the President Barack Obama. And one of the things that, one of the many things that this brought to, like, how to say it, like the laws that was implemented, it was that mental health had to be like, mental health services had to be covered by the insurance. And on the other hand, we have like current administration, or like the opposite parties, and normally like Republicans, parties are more of like the US government shouldn't be taking care of that much of healthcare. Yes, we can do this and that, but like that shouldn't be the top priority. But one of the reasons that for me it's just like mind blowing is that why is this part of why is this still kind of like that we have to prove that mental health illnesses is something that we need to take care of? Because right now, if I go back to the notes, and the thing is that I don't only have notes for this class, but like I mentioned before, I'm taking a US healthcare system class in which there was chapter 6 that was all mental health illnesses, or mental health administration. And one of the things that it was so surprising for me, and at the same time, I don't understand why people don't. Okay, the thing that was surprising for me is that under Constitution, the only, like one of the only parties or the only people that are protected to have health coverage by by US is people in jail. Like everyone that is in jail, they have the right for healthcare services. And that's a little political. I'm not saying that they shouldn't be covered, but you know, there's something that we are missing, because the other important information that was also in that book that I have in my notes that I had to go back to kind of reread, and I do want to share it, is the fact that the largest institutions that provide psychiatric care in the US are jails. And that's the part that is not surprising for me, and I don't understand why it's surprising for like everywhere that I read. It's like, wow, like prisoners have a lot of psych disorders. But if you think about it, in order for you to commit a crime, you know, there has to be something up there that is not right. So why are we not focusing on bringing rehab services and other like services that could actually make this, you know, population, which is the highest in psychiatric and mental health disorders, to address that? But on top of that, it also talked about the substance abuse and all that. And I just feel that, you know, in all the readings, it does have a correlation. Now that I mentioned the drug abuse, it has a correlation that people with drug abuse have mental illnesses. And, you know, mental illnesses can also give you a higher risk of being drug or alcoholic and all that. So, seeing that throughout the years, they've been putting the treatment as an outpatient, it's helpful. And even like what Kennedy brought in, you know, to do more community-based places, instead of just like, because before it was just like this hospital that you will just keep all the crazy people locked in, and then whenever they feel better they can go outside, which makes no sense. So now let's make more community based so that they can still be part of the community and have service within a community. But I feel that definitely the system itself has to be, there's something that it's either being missing, or it's definitely being not prioritized adequately. Because the other thing, you know, going back to the Affordable Care Act, yes, like that, in this case, I can talk about my experience. I have a marketplace insurance, so I do have, you know, coverage for it, but the people that take my insurance don't have appointments for months. Like right now, I can have my prescriptions or my appointments a little bit sooner, 2 or 3 months, because I'm an established patient. But for new patients, it's like 4 or 5 months. So there's not enough providers to keep up with all this like laws and things that they're making. And then it also brings to my attention and kind of worries me the fact that there's a whole article talking about Medicaid now requesting people to do the job, to work or to do some sort of activity to get the Medicaid, which that's excellent. Yet how are you making an example of mental health, like if for a mental health person, when there's not enough mental health providers to keep up with the current situation that now we're gonna add something more to the plate that is gonna make it even worse, because there's a shortage, and on top of that, the people that are like the mental health providers that we have right now, a lot of them do not take any of this like Medicaid or marketplace, because they don't pay the money that the psychiatrists and psychologists ask for. They feel like they are underpaid when they take this type of insurance. So you either have a provider that takes your insurance, but the next appointment is in like 5 business months, or you have a provider that will take you tomorrow, but you will end up with a $200 bill after the visit. Now we can kind of understand why there's like this whole situation, and it looks like it's out of control. And the other thing that I wanted to mention, it was that, you know, like we can tell throughout the years that, once again, this has been part of the conversation. But another factor of us right now is that, yes, you know, mental health illnesses was like discussed for a while, but after 2020, after COVID-19, it has skyrocketed all of the rates, especially like suicidal rates and mental illness, like anxiety, this depression, and others that are just like, you know, we had schizophrenia, bipolar, like all of those were there, but like anxiety, suicidal rates, and the severe depression after COVID-19, they have skyrocketed. And I remember that I was in a behavioral psychology class a couple semesters back, and I did a project about I picked the topic about suicidal rates in teenagers of minorities, so Hispanic, African American, Asian, and other racial that were non it had a name that, oh god, I forgot the initials, but it was technically, the research that I had to read couldn't be done in like, it couldn't be, there was like the requisites. That's why I took the suicidal rates on Hispanic and Afro-Americans and other races. And first of all of those researches that were done after 2020 received no grants, no money, no nothing. They had to do the sources in order to make those research had to be like couldn't have any cost at all. So a lot of them were made by CDC surveys, like the Youth Risk Behavioral Surveillance System, that it's made to like school students, and other like, you know, surveys that did not had any money involved, so they couldn't ask directly to patients or to make like trials or any of that, because there was no money that was put into this kind of research that are to know the actual numbers. And the reason why, because another big thing, and I'm not sure if it was mentioned in I don't think it was mentioned in our book. It was probably like the other book. Like I said, I have both class mixed in my brain. Is that US has the highest number of suicidal and mental health deaths in industrial countries. So from all of the industrial countries, US has the highest death rate. And if that's not something that we need to worry about, I don't know what it is. Like between that and most of our like bigger institutions of mental health, our prisons, it's something very, very, very alarming. Because like I said, I remember as a CNA, I remember one case that I had that girl for multiple days, sorry, I was a day shift. And pretty much on day 3, I remember that the ER staff did not know what to do with her because we were not equipped for her. And there was no place to have her, like, placement, because she, you know, this patient was 18 years old, so borderline, almost she was pediatrics, but no, supposed to be in an adult institution. Nobody wanted to take her because it wasn't even a Floridan. Like, she came from other place, so we don't know where she came from. Insurance was an issue. Placement was an issue. There was no family members because, you know, it was right next to the airport. So the one thing that it was like impressive in that case, it was that because the hospital was so close for the airport, there was a lot of patients that were just, you know, doing what's it called? You take a flight and then you take the other one. I can't think of the name right now. I'm sorry. But, and a lot of people that were just not, you know, that either the airport people or somebody realized that they were not safe for themselves or from others, they will take them and take them to the hospital. So it's like, you're bringing people from the airport to the hospital. We're not equipped with a mental health floor or facility, and there's no mental health facilities that will take the patients. And the main reason why there's no mental facilities is because they cannot financially stay operating, because at the end of the day, they're all businesses, like we mentioned before, like we keep reading throughout all of the, you know, chapters about U.S. healthcare system. This is all a business at the end of the day. So the places, the mental health places are closing, yet your biggest ones are prisons. So somebody that is not in prison cannot take that kind of service because, you know, it's just something surreal and impressive for me to even like understand. But like I said, I feel that there's a lot of complications, and you know, it's very sad that over 30 years later we're still debating if this is important or not, or if this should be a top priority. And like even providers, like we're not finding ways to bring more providers or to reward people to become providers. So especially here in Florida, that we know that, for example, nurse practitioners cannot practice if they're not under a physician. And I've seen a lot of really good providers. Like my provider personally is a nurse practitioner, and that he is excellent. He's been way better than a lot of physicians that I've known before him. So those are little things that it has to be addressed and worked in order to have a better outcome and better results, in my opinion. And like, and all the you know, notes that I take, I feel like that's kind of the way. But hopefully it kind of makes sense. Everything that I said, I knew I was gonna talk for a while and it was gonna be a little bit extended, especially with, you know, I really wanted to mention those like experience and all that. Another thing, once again, going back to the Medicare or Medicaid, you know, we need to understand better ways or make better policies, because the fact that Medicaid do not pay for long-term health treatment, and the most that they will pay for is just like you know, your medications, and that's it. And a lot of their expenses are in ER visits, because we know that has turned in one of the places that a lot of mental health illness people end up with. And like I mentioned in my experience as a CNA, I've not only read about it, but I've seen it. I've seen so many people end up in an ER, especially here in Florida, that we have the Baker Act, and they're not equipped. Staff are not equipped. Staff are not equipped or trained properly to address this population. I feel like all of the mental illnesses, doesn't matter if it's drug addict, alcoholism, bipolar, or whatever, they're all so misunderstood and so mistreated that it's sad that even now in 2026, after COVID-19, we're still struggling with it. But I'm gonna stop here because like I said, I will definitely extend this a little bit more. But Hopefully I will continue on reading and making more notes about it. Any feedback or anything that it didn't make sense, or I just kind of like took it out the conversation, please let me know so that and we can even discuss it further in a meeting or with other students. Okay, have a good evening. Thank you.